Welcome to Chapter 8 of Mental Health Nursing, 6th edition. In this lecture, we will explore psychotropic medications, therapeutic environments, major psychotherapies, counseling, electroconvulsive therapy, and crisis intervention. By the end of this chapter, you will be able to 1. Describe a therapeutic milieu. 2. Identify classifications of psychotropic medications. 3. Discuss uses, actions, side effects, and nursing considerations. 4. Describe psychoanalysis. 5. Explain behavior modification. 6. Identify the nurse's role in counseling. 7. Describe types of counseling. 8. Explain ECT and nursing responsibilities. 9. Identify crisis phases and nursing interventions. Altered emotional health can affect many areas of daily functioning. For example, cognition may become impaired, emotions may increase or decrease, grooming may be ignored or overly emphasized. Psychopharmacology involves the use of medications to treat mental health disorders. 2 major reasons medications are used include symptom control, improving compliance with other therapies. The first major classification of medications used for mental illness emerged in the 1950s. Phenothiazines were among the earliest antipsychotic drugs used to treat severe psychiatric symptoms. Major drug classifications include antipsychotics, anti-anxiety agents, antidepressants, tricyclics, SSRIs, SNRIs, MAO inhibitors, anti-manic agents, stimulants, anticholinergics, non-prescription treatments such as herbs. Example, SSRIs, like sertraline, are commonly prescribed for depression and anxiety disorders because they have fewer side effects than older antidepressants. Common side effects vary by drug class. Antipsychotics may cause extrapyramidal symptoms. Anti-anxiety agents may lead to dependency. Tricyclic antidepressants may cause lethargy. MAOIs may also cause lethargy. Example, a patient taking benzodiazepines may become overly sedated or develop dependence if used long-term. Extrapyramidal symptoms, or EPS, typically appear 1 to 8 weeks after starting antipsychotic medications. Symptoms include muscle rigidity, tremors, drooling, shuffling gait, mask-like facial expression. Another serious antipsychotic side effect is tardive dyskinesia. This includes involuntary movements such as chewing motions, constant blinking, or facial grimacing. Psychoanalysis, based on Freud's theory, focuses on unconscious thoughts and past experiences. Techniques include free association, dream analysis, catharsis, behavior modification therapy developed from behaviorists like Skinner and Pavlov. Its purpose is to eliminate or reduce unwanted behaviors using positive reinforcement. Cognitive therapy is linked to Albert Ellis and rational emotive behavioral therapy. Person-centered therapy focuses on the present and emphasizes unconditional positive regard. Example, a nurse may help a patient challenge the thought, "I'm worthless," and replace it with, "I'm struggling right now, but I have support and value." Milieu refers to the therapeutic environment. Key beliefs include the environment affects behavior. Safety is essential. Patients need acceptance. Counseling is a broad category of therapy, including pastoral counseling, cultural counseling, group therapy. Example, a grieving patient may benefit from pastoral counseling, while someone with addiction may benefit from group therapy, such as Alcoholics Anonymous. Electroconvulsive therapy is used when depression or schizophrenia does not respond to other treatments. Example, a patient with severe suicidal depression who has not improved with medications may experience significant relief after ECT. Nursing responsibilities include monitoring vital signs, assessing response, ensuring safety precautions. Before ECT, The patient must be NPO for 4 hours. The bladder should be emptied. Dentures must be removed. Example, this prevents aspiration and injury during the procedure. A crisis is an unexpected event that disrupts routines and creates loss of homeostasis. Example, a patient who has just lost a spouse may suddenly experience panic, insomnia, or suicidal thoughts. Crisis phases include crisis, adaptive, post-crisis. Goals of crisis intervention include ensuring safety, diffusing the situation, identifying the problem, returning the patient to functioning. Example, if a patient becomes violent or threatens self-harm, the nurse's first action is to call for help and ensure immediate safety. In crisis situations, nurses must follow agency policy, stay within scope of practice, call for help when needed. Example, a nurse should never attempt restraint alone, but should use the trained team approach. Today we reviewed psychotropic medications, therapeutic approaches, counseling, ECT, and crisis intervention. Understanding these treatments helps nurses provide safe, therapeutic, and effective mental health care. Thank you for watching.